supplement the efforts of NEPA. So most of our health institutions now don't face the grim prospect of power failure because of interrupted electricity supply. But of course, unless we pay NEPA what we owe, then we still run the risk of being disconnected, but we are going to make sure that we can settle this debt as quickly as possible. Now, I want to talk briefly about refurbishing and rehabilitation of our health institutions. General Hospital Lagos and Lagos Island Maternity are probably two of the hospitals that need a lot of attention. And you remember we launched a foundation in order to rehabilitate these two hospitals. But while we are trying to redeem pledges, because a lot of money were pledged for this, we are still trying to collect the pledges, but we have received quite a substantial amount of money. The Lagos State government has paid their own donation of 20 million. I'm sure you'll be happy to hear. I hope within the next week or so we'll be able to receive the remaining of the federal government pledge. The other private individuals are also redeeming their pledge. Even yesterday we still got some checks. So those of you who are here, who are in a position to help us to collect some money, please feel free to see it as part of your Christmas to New Year donation to the hospital. The General Hospital Lagos has been given some facelift. We've done some internal painting of the place. Some of the toilet facilities have been improved, and some other minor rehabilitation work have been carried out. But the major aspect will have to wait to be tackled from the funds from the hospital foundation. Now, Lagos Island Maternity, of course, really is one hospital that if one had the resources, you probably would say, build a new place, because it is in a very, very bad shape, as we mentioned during the launching of the hospital foundation. But while we are waiting, and I can tell you categorically that by the grace of God, come January, that work will start as far as the rehabilitation of Lagos Island Maternity also is concerned. But while we are waiting for that, we have taken some steps to relieve hardship. For the first time in 10 years, we now have an elevator in Lagos Island Maternity Hospital. So the question of anybody falling downstairs or people pregnant in labor having to go upstairs now does not arise at all. We do intend to put in another elevator there before long. We also, contract has also been awarded for the construction of steel tanks to improve the water supply, because you know it is the baby factory of Nigeria, and if we say hospitals need water, they more than any other hospital need plenty of it. The contract for the steel tank has been awarded, and we hope this will be completed in January next year. We are also address our minds to some other minor rehabilitation, but the major contract for the place will be tackled, as I said, in January. Now, also as part of our efforts to rehabilitate the hospitals, the two elevators which were not functioning in Bagada General Hospital have been fully rehabilitated. And we also have carried out some construction work, terrazzo floor, to make the place nice and tidy. Some that were made of wooden partition we have converted to concrete wall. One or two of our future plans. You all will recall the tragedy of the Air Force plane crash, and a lot of people wanted to know what plans do we have for disaster. Nobody prays to have disaster, but what plans do we have? I'm happy to report that we have set up a committee to devise a disaster plan for Lagos State. That is, any time there's problem, to get medical manpower there, to get people there that would help to carry out resuscitation, to get people there that will be able to serve in the situation. This is something we have done. The committee has been working very hard, and before long we'll come out with the plan to make sure Lagos State, although we don't pray for disaster, but that any time there's problem, that we are able to respond appropriately. And I'm sure you'll be happy to hear that. The citizens of Lagos State is what I would like to describe as something of a novelty. Novelty because everybody knows the problem of transportation in Lagos. You want to get to work, there is problem. You want to come back from work, there is problem. Not to talk of a patient who is sick at 2 or 3 o'clock in the morning. How do we get the patient to the hospital? If the parents or the family do not have cars, how do we get the patient to the hospital? So I'm happy to tell you that we have decided to set up a Lagos State ambulance service. There are right away 2 ambulances, brand new ambulances are being made available. We've taken delivery. One will be stationed at General Hospital Lagos. The other one will be stationed at General Hospital Ikeja. How do they function? What the service will entail is that any patient that needs an ambulance will telephone numbers which are going to be specially designated for this service. You telephone the hospital, you are in trouble, you need an ambulance, and the ambulance will go to your house, bring the patient to the hospital. And we are not restricting it to whether the patients are coming to us. Even if the patients are going to Luz Orthopedic Hospital, we will still make the service available. So this, I think, is going to help a lot of us. I know that we will need more ambulances, but we need to make a start. Right now, some come in taxis, some come in motor, some come in all kinds of vehicles. Some people in labor have delivered in private, transport. But we want to make sure that Lagos State citizens are not exposed to any hazard, and this is why we think this idea of ambulance service must start now. That is long overdue, and I hope we can rely on the support of everybody to make sure it's a worthwhile service. We are going to make sure whatever token fee we charge will be something that people can afford, because we are not catering for rich people, we are catering for everybody. Therefore, this service will attract only a small fee to make sure that even the market women, the laborers, and the poor people can benefit. Now, the other things which I want to tell you just relate to the atmosphere in our hospitals. What are the situation reports? Health institutions have often been castigated and accused of not caring for the masses. The attitude is not good. People don't respond. And I will want the public to be the judge of what we have done over the past 1 year. I've mentioned about low morale. I've mentioned about poor remuneration. But now that we have addressed this point, we have also tried to improve the relationship between doctors, nurses, and the patients we care for. The way they are received, the way they are cared for, the way they are attended to. And I would want anybody from the private sector or any member of the public to now go and compare what it is like now to what it was before. The casualty hospitals, in both Lagos and Ikeja, are now so structured that no longer do we have people sleeping on the floor. No longer do we have people managing. Patients are taken to the ward as soon as they are evaluated, and we also make sure nobody is delayed there for more than is necessary. So 1 hour, even less, is the sort of time, so that as soon as they are sorted out, they go to the ward. And I think with what we have done, we are very happy that we have made a good start. We have made a good start, and we hope, God helping us, are even going to do better in the new year. But we need your cooperation. We can't do it alone. All of you will need to help us in order to achieve the worthwhile results. We believe Lagos State will excel. It's already started to excel, and it will excel by the grace of God. Thank you very much. Now, I would answer a few questions if there are any questions, so that it's not a one-way